Good afternoon. My name is Jane Hinson, and I'm the Iredell County Health Director to give you an update on COVID-19 initiatives in Iredell County. Today, we've had 11,132 positive cases. 75 individuals are hospitalized today, and unfortunately, we've had 131 deaths. I wanted to update you on the COVID-19 vaccine work that is going on in Iredell County and also dispel a few rumors. The vaccine has been tested, it is safe, and it is effective. You cannot get COVID-19 from the vaccine. What I want you to understand that right now the supply is very limited and it will continue to grow incrementally. The two vaccines that have been approved in the United States are the Pfizer and Moderna vaccine. 70,000 people were involved in trials for these vaccines, and we know that they're 95% effective at preventing illness. Even if someone happens to get infected, after being vaccinated, they'll have a less severe illness. The Pfizer vaccine is for individuals age 16 and up, and the Moderna is for individuals ages 18 and up. The vaccines safely increase your body's natural ability to fight the virus before the virus attacks you. The technology that was used to develop these vaccines has been around for years. The vaccine gives your body instructions to make a protein that safely teaches your body to make an antibody to fight the real COVID-19 virus. After vaccination, you can fight this virus. Now, there are some temporary reactions. You could have a sore arm, you could have a headache, or feel a little bit tired or achy for a day or two. You receive a second dose 3 to 4 weeks after the first dose, and this is based on which manufacturer the vaccine is that you received. Within 2 to 3 weeks of receiving the second vaccine, you should have immunity. So if you're exposed after that time, we know that that immunity should protect you. What we don't know is how long that protection lasts. Research will continue throughout the following months so that we'll get a better idea on exactly how long you'll be protected. There is no ingredient in this vaccine that can be tracked. The protein that your body makes, it disappears after making you stronger and making you able to fight this vaccine. We've heard rumors, government's going to put a chip in this, there's going to be something that's going to use to track me. That is absolutely not true. None of your protected health information in regards to your vaccine will be shared with the CDC. All of these vaccines are free. In Iredell County, we want to be able to vaccinate every single individual that wants a vaccine. As I said earlier, supplies are very limited at this time. Right now, only our 3 hospitals and the health department have vaccines, but we know in the very near future, enrolled providers will receive vaccine. This could be private physician practices, this could be pharmacies, urgent cares, and when that happens, vaccine will be able to get more quickly into the community. Now, how do we make decisions regarding who gets that vaccine? The CDC and the North Carolina Department of Health and Human Services have developed prioritization recommendations for the vaccine because we just don't have enough to give everybody vaccine right now. Our current priority groups are healthcare workers who take care of individuals who have COVID-19, long-term care staff and residents, and adults age 75 and older. Our hospitals have received vaccine, they have vaccinated their staff, and are actually reaching out in the community to try to reach additional healthcare providers that take care of individuals that are COVID positive. At the health department, we have had 4 community drive-through clinics. We find out the allocation of our vaccine the end of the week prior to the next week, making it very difficult for us to schedule clinics. We don't know until we're told that week exactly how many doses that we'll have. What we have done to date is, as soon as we receive vaccine, we are scheduling clinics in the community. We are doing that to get vaccines in your arms instead of holding on to that vaccine. I will tell you that we are very sorry. We know last week at the Stumpy Creek Clinic that way more individuals that we could have anticipated arrived. There were traffic problems, and from every situation, we make improvements. We learn from that, and we were contacted by several individuals, and we thank you for your recommendations. Again, our goal is to get vaccine to you as quickly as possible. This week's clinic will be held Thursday, January the 14th, this Thursday at 10 a.m. at Mazeppa Park in Mooresville. And again, we have limited vaccines, so we will continue vaccinating as long as we have the capacity to vaccinate. Now, what happens? Do you need to wear your cloth face covering after you receive your vaccine? What we know is, right now, not enough people in the United States have either tested positive and have natural immunity or have been vaccinated for us to stop wearing cloth face coverings or social distancing. In fact, just last week, I read research from the CDC that 59% of the transmissions in the United States are from individuals who are asymptomatic. What that means is 48 hours prior to developing symptoms, there's been transmission, or individuals who never develop symptoms at all. So you can't look at someone and know whether they're infected or not. We will be happy to answer any of your vaccine questions. Please call us at 704-878-5300. Go to the Iredell County website for the latest information on clinics, or if you have questions regarding what provider group you may be in. Remember, always wear your cloth face covering when you leave home, when you're around individuals that are not your immediate family that you live with. Wash your hands frequently, social distance at least 6 feet when you can, and get vaccinated. There will be a vaccine for you. Thank you.